Hi, Lisa. Thanks for the post. I really appreciate that you outlined the procedure that would follow an incident such as the one that was described, both from a punitive standpoint and from a safety standpoint. It's important to know not only what constitutes problematic patient care, but also why that care is wrong and how to handle such a situation. I also really like that you emphasized how important impartiality was during incident reporting, for both the patient and the employee's sake. A misunderstanding or lack of knowledge on the part of the healthcare worker can easily be painted as malicious, or vice versa, with the correct embellishment. Impartiality supports the truth and allows for a more adequate and useful decision to be reached upon review of the incident. One of the points that you touch on in your discussion is that a patient always has the right to refuse treatment as long as they retain their capacity to make decisions. The scenario in your discussion got me thinking a little bit about the strange gray area that many healthcare professionals sometimes have to practice in, be it on an acute care floor that houses mentally ill or impaired individuals, or in a home care setting, caring for aging patients with progressive neurological disorders. An interesting 2021 study I stumbled on in the publication Clinician Interventions with Aging highlights the challenge faced across a variety of scenarios demonstrated in 3 real-life case studies. These case studies demonstrated varying levels of capacity in situations where certain forms of consent were acceptable while other types of consent weren't. None of this really has much bearing on your specific scenario, given that the aide there was obviously in the wrong, but I do think that it's worth considering what this scenario might look like in the context of a different or varying levels of patient capacity. That thought experiment kind of raises some uncomfortable questions about what we might consider appropriate treatment in certain circumstances. So anyway, thought that was just kind of an interesting thing. So again, thanks for your post and have a good week.